Hi, I'm Heather Shaughnessy from the Broomfield location of Altitude Physical Therapy, bringing you another anatomy lesson today. Today we're going to be looking at the hip flexors. So when most people refer to the hip flexors, there's three main muscles that they're talking about, and we're going to talk about what those three are. So first off, we're going to look in the hip here. I'm going to hide one little muscle out of our way, and then we're going to look at the rectus femoris here. This is the first of the three hip flexors that I'll talk about. You can see it's actually one of the quadricep muscles. So it does come down here all the way to the knee. So when you contract your quadricep muscles there, it does help straighten the knee. But it also helps with hip flexion, which is the movement where you bring your knee towards your chest. And you can tell that it does that because that top end of it comes up through the front of the hip and attaches onto the pelvis, whereas the other quadricep muscles actually just attach onto the femur, which is the thigh bone. And the next muscle that we'll look at is called the iliacus right here. It's a pretty broad muscle. It lives right on the inside of the hip bone or the ilium. It lives kind of deep in there. If you were to hook your fingers along the inside edge of that hip bone that I just highlighted in blue there, you can actually kind of get onto your ilium, onto this upper edge of it. And you can see that it lives kind of deep in there, but the tendon does come around the front of the hip and then goes, dives down into the hip and attaches onto the femur to help bring your knee towards your chest. And then we're going to look at the last one that a lot of people have heard of, but a lot of people don't have a good idea of where it actually lives. But to do that, we have to hide a whole bunch of stuff. So I'm going to go through and hide a lot of these intestines in here. And we are going to look at your psoas. So a lot of people have heard of the psoas, but aren't totally familiar with where it lives. It lives right there. I highlighted it in bright blue. And if we turn our little muscle lady here to the side, we can see how far back in the abdominal cavity that lives. In fact, the upper end of that psoas, still highlighted in blue there, actually attaches along the sides of the lumbar and even up into the thoracic vertebra. So it lives kind of on the back side of you, at least the majority of it. And then if we look at if we turn around to the front again here, you can see that at the end of it, it does come around through, sorry about that, come around through the front of the hip with that iliacus, and then comes around on the front side and dives down in towards that femur, and then it attaches there, and that's how it helps flex your hip. But it lives really deep into the back of you, and a lot of people are very surprised to learn that. So, quick recap, the three main hip flexors that we talk about, rectus femoris, which is one of the quadricep muscles, iliacus, which lives right on the inside of your hip bone, and psoas, which actually lives really deep in there, kind of alongside the back side of the abdominal cavity. And those are your main hip flexors. I hope you learned something and have a great day.